Hi, my name is Dr. Simon Funky Funk. I'm a radiation oncologist at Roswell Park Comprehensive Cancer Center. At Roswell Park, we believe an important part of delivering quality radiation treatments is, when appropriate, using respiratory motion management. Oftentimes, this is important when delivering radiation treatments to cancers in the chest, such as for breast cancer or lung cancer. Additionally, respiratory motion management may also be important when treating cancers in the abdomen, such as the esophagus, the liver, or the pancreas. When radiation treatments are used for patients with lung cancers, as the patient breathes, tumors often move with each breath. To treat the patient while they're breathing, the radiation field often needs to be larger to encompass the tumor as it moves. Using respiratory motion management, sometimes using a deep inspiration breath hold, immobilizes the tumor as the patient is holding their breath. This allows the radiation oncologist like myself to design a smaller radiation field, which ultimately exposes the patient to less radiation dose. For patients with cancers in the abdomen, such as cancers of the esophagus, the liver, or the pancreas, respiratory motion management may also be important. Sometimes when patients are breathing, as the diaphragm moves, the tumor also moves. Treating patients while holding their breath using a deep inspiration breath hold technique may minimize the motion of the tumor and also expose less of other critical organs in the abdomen to the harmful effects of radiation treatments.
Before beginning treatment, you will go through a procedure called simulation. During simulation, the radiation therapists will set you up in the position that you will be treated in and take a CT scan. This scan will be used by the doctor to create your treatment plan. Once you are positioned, a small cube will be placed on your abdomen. A detector uses this cube to track your breathing pattern based on its movement. The therapists will ask you to breathe normally. During this time, try to keep an even, natural breathing pattern. At some point, the therapists will ask you to take a breath in and hold it. When doing so, slowly take a deep breath in and stop where you naturally stop. You should not try to strain yourself when holding your breath because you will need to be able to do this consistently. It is also important that you only hold your breath when the therapists ask you to do so. The therapists will then give you a visual aid to help you with the breathing exercise. These glasses will be placed on you while you are still holding the same position. In the glasses, you will see two bars, one yellow and one blue. The yellow bar will be moving up and down as you breathe in and out. This represents your breathing. The blue bar is stationary and represents where you hold your breath. The therapist will practice with you, asking you to take your breath in so that the yellow bar moves up into the middle of the blue bar and turns green. It is important to hold the yellow bar as close to the middle of the blue bar as possible to keep consistency. When bringing the yellow bar up, avoid arching your back to help it go higher because it will not be reproducible or accurate. After practicing with you, the therapist will step outside of the room to take the scan. You will then hear them tell you over the intercom to take your breath in and hold it. While outside the room, the therapists are looking at the same screen with the bars as you are. If the bars go away at any point during, before, or after the scan, it is because they are retracking your breathing pattern. During this time, you should breathe normally and consistently. When you return to the department for your treatments, you will be set up in the same position that you were in for simulation. In the treatment room, the therapists will give you the same visual aid glasses that you wore and place the cube on your abdomen to attain your breathing pattern. The therapists will then step out of the room and begin the treatment process. The same bars will be displayed in the glasses and the therapists will tell you over the intercom to take your breath in. Just as you did before, take your breath in and hold it so that the yellow bar is in the middle of the blue bar and turns green. When the yellow bar is held in the blue bar, the machine is on and your treatment is being delivered. If the yellow bar is above the blue bar or falls below it, the machine turns off and no radiation is administered. The therapists will often give you a break if you need to hold your breath for a long time. However, if at any time during the treatment you need to take a break, you may do so and the machine will turn off. While outside the room, the therapists are watching your breathing on the screen. As before, if at any time the colored bars disappear in the glasses, it is because the therapists are retracking your breathing pattern and you should breathe normally. They will often do this if there are any changes in your breathing pattern.
Practicing this deep inspiration breath hold technique at home may make your treatments easier. Of course, if you have any questions about this, feel free to ask any member of your radiation treatment team.